Western Australia's Liberal leader and the Australian Medical Association of WA have criticised the lack of transparency by the McGowan government in relation to their COVID plans. Holly Edwards-Smith is live for us in Perth. Holly, the WA Health Minister held a news conference a short time ago. Did she indicate when that information might be released?
Ash, the Health Minister, Amber Jade Sanderson, wouldn't give a clear date for when West Australians can expect some information about how the state will look when borders open in less than 2 weeks on February 5. She did indicate that some information may be released to certain industries this week, but again, wouldn't go into specifics. The state government is facing some backlash, not only from the public and businesses wanting some clarification about definitions for close contacts, as well as testing requirements and restrictions when borders do open and COVID enters Western Australia, but also from leaders. The president of the AMA has been quite outspoken in his desire for this information to be made public and released. And today, the WA Liberal leader, David Honey, said that he will be backing the Western Australians' bid in Freedom of Information requests, saying that he will be putting multiple forward for information around the documents outlining rules and restrictions from February 5, as well as correspondence between regional health services and the state government, and including date and times for the state disaster meetings. He said that the state government at the moment is the least transparent of any government in WA's history, and is urging the McGowan government to be more forthcoming with this information. The Health Minister indicated today that some industries, like health departments, may be getting briefed on information relating to COVID plans this week. She wouldn't announce whether or not this information was coming to the broader public. However, she said she did wish that it would be announced as soon as possible.
I would like that information to be delivered this week, and there'll certainly be information going to the healthcare workforce this week around what they are.
And Holly, I understand some concerns have been raised about the Chief Health Officer's media presence.
Dr. Andrew Robertson hasn't been at a number of press conferences recently, and there is growing concern that, growing desire for him to be at these conferences in order to answer questions relating to the decisions around restrictions and what the state will look like when borders open in less than 2 weeks. The AMA WA President, Mark Duncan Smith, has said he thinks the Chief Health Officer may be being gagged by the state government and that they are ignoring his advice. However, today the Health Minister said that she speaks with the Chief Health Officer and sees him multiple times a day, and that he is definitely not being gagged by the government.
I've seen the Chief Health Officer more than I see my own family. I'm more than happy for him to come along to the next press conference.
And Holly, the state is trying to control what at this stage is a small Omicron outbreak compared to the East Coast. How many cases were recorded today?
Ash, there were 5 cases recorded today. 2 were classed as locally acquired and 3 are travel related. The 2 locally acquired cases include one person who is a deemed close contact and has been in quarantine through their infectious period, not posing a threat to the community. The other is a man in his 60s, and the Health Minister said that he is believed to be linked to the Coburn cluster, which is related to the Omicron strain, but wouldn't release exactly where he transmitted it from, but says police work has determined that it's likely linked to that cluster, and genomic testing is underway to confirm that. More exposure sites are expected to be listed. However, more concerning, this man attended a hospital with non-COVID related symptoms, and that's where he was tested and found out to be positive. The Health Minister said that this demonstrates that there most likely is some Omicron cases around the community that aren't being detected. This man has 4 housemates who will also be taken to hotel quarantine and have been tested, and more exposure sites are being added. 12 staff at Fiona Stanley Hospital have been put into quarantine as well, and with the current COVID restrictions of close contacts, they will be in isolation and quarantine for 14 days. The Health Minister said that is what the guidelines Western Australia is currently working at. And she also announced today that the modelling we were expecting here in Western Australia about Omicron may not be released for some time, as more is being learnt from the strain and exactly how transmissible and what its death rate will be.
Omicron has only been in the community since the end of November. That is not enough time to get a full data set to get a clear picture.
It had been previously announced that this information around Omicron modelling would be released around the time borders open. At previous press conferences, it was said that it would be out in a number of weeks. Western Australia's COVID transition plan is currently based off Delta modelling. However, it seems today the Health Minister has confirmed that Omicron modelling won't be the basis of rules and restrictions that come into effect when borders open, but we can expect these at some time in the next week.
Holly Edwards-Smith, live there in Perth. Thank you.